9.
9. Nak tengok muka semua. Berapa persen?
Saya doktor.
You present.
Ha.
Dah ready dah?
InsyaAllah.
Oh, mandi ke tak mandi ni?
Mandi.
Mandi
doktor.
Mandi ke tak? Macam tu je, macam memang sejuk. Sana hujan. Kat mana ni? You kat mana? Ni nampak ni Tu apa ni?
Doktor kuarantin ke doktor?
Tahu pun. Nampak ni Kuarantin sekarang ni. Tak boleh ke mana 10 hari.
Ada kes dekat Susmed ke doktor?
Susmed lah, mana lagi? Dah balik dulu lah, berterabur. Minggu depan lagi berterabur. Semalam 150 orang tu swab. Okey, siapa present?
Ya, doktor.
Afrina present. Ya, tertulis nama lagi. Afrina ya.
Okay, bismillahirrahmanirrahim. Okay, so I'll be presenting my case for today. So the chief complaint is Ryan, an 11-month-old infant, was brought to the accident and emergency department of Hospital Sultan Haji Ahmad Shah, Hoshas, due to sudden onset of rapid breathing. So the history was taken from the mother. Prior to admission, Ryan was apparently well for 2 days after he recovered from a fever of 1 week duration. His fever was on and off in nature, and the temperature usually peaks at night at around 38 degrees Celsius. There were no fitting episodes, no chills, no rigor. Despite having fever, Ryan stayed active during the day. His mother did mention that Ryan had eye discharge during the fever. Otherwise, Ryan had no recent contact with water or soil, and there was no fogging being done recently around his residential area. The fever was associated with runny nose. There was clear and watery discharge running out of his nose all the time. Apart from that, Ryan also had cough that was chesty in nature 3 days prior to the admission. The cough was persistent throughout the day. No barking or whooping cough were noted. There was history of post-tussive vomiting once, but it is not projectile in nature. The vomiters contained porridge that was given by his mother as his meal. No blood or bile content were noted in the vomiters. No history of night sweat and no history of contact with TB patients. Ryan recovered from the fever 2 days ago, as in 2 days prior to the day of clicking, after his mother gave him syrup paracetamol. The cough, however, was not relieved even after medication was given. Unfortunately, his fever came back on the day of admission. The mother also noted that Ryan had lost some weight due to poor oral intake during the fever. A few hours prior to the admission, the mother noticed Ryan was breathing rapidly, and it was accompanied with wheezing sound and subcostal recession. It was sudden onset, and it happened at rest. No facial congestion and no cyanosis on his lips were noticed. Other than that, Ryan also had a history of passing loose stools a few days prior to admission. The mother described the stool as chocolate in color, and after Bristol stool chart was shown to the mother, she described the stool to be watery, having no solid pieces, and was entirely liquid, as in the type 7 stool in the chart. Bowel output increased with no definite frequency and minimum volume, while urine output remained normal. But the mother did claim that this may be due to his... Sorry?
Ya, kejap.
Okay.
Ada apa? Sampai berapa jam? Saya continue. Peliknya lah. Kita solution orang datang nak melawat pula. So halah balik.
Okay, continuing the
Pelik
history
orang
of
Melayu dia. Continue.
consent. Okay, continuing the history of passing loose stools just now. Okay, so it is described as type 7 stool in the chart, and bowel output increased with no definite frequency and minimal volume, while urine output remained normal. But the mother did claim that this may be due to his formula milk being changed recently. Upon further questioning, the mother mentioned that Ryan had sick contact with his older brother, who was also having cough. She also revealed that Ryan's father is a smoker. There is no family history of asthma.
You finish lah, HOPI lah.
Last sentence. There's no family history. There's no family history of asthma or other atopic disorders, and Ryan himself does not have eczema or allergic rhinitis. There's no pets or any exposure to dust being reported, and there's no history of exercise or cold-induced symptoms. So that is the HOPI.
Dah.
Dah.
Okay, Shamima, any question?
I want to ask regarding the loose stools. Does the patient is in dehydrated state?
No, the patient was not in dehydrated state despite the history of passing loose
How you
stools.
know patient not dehydrated?
Because in HOPI, there's no symptoms of dehydration, such as unusual tiredness, no history of unusual tiredness, no history of dry diapers for a long time, no dry mouth.
You tak mention pun, do you mention that?
Oh, no.
You see, if you don't mention, consider as
HOPI.
You don't know about that.
Oh, okay. But in the general examination, then
I asked you about HOPI.
Okay.
What in the history that you want to know that the child probably is dehydrated?
Signs as a
history. You already mentioned tired and lethargy, but that one can be due to that one. Anything else?
Dry mouth.
Dry mouth is examination.
Okay.
Your mother can notice lah sometimes. Anything else?
Urine output. It remain normal. It says.
And this is mention about urine.
Yes, I did mention the urine output.
Apa mention dia?
Urine output remain normal. Only the bowel output increase.
Pardon?
It says bowel output increase, but urine output remain normal.
What you mean normal?
There's no decrease urine output.
How many times per day passing urine or change pampers?
Fewer than 4 times a day, maybe? Consider as a normal.
This case, how many times?
She does not mention in the HOPI.
Tak mention Anything else?
It was not mentioned as well in the case right up.
Ask lah, you present the case, that's it you lah. They're asking you what is the evidence you want to look at to know that the dehydration status. The mother can notice.
Dry skin.
Usually mother cannot notice. Anything else mother can notice?
When crying, there's no tears.
Nakut? Any questions?
The mother can there is a presence of tears. Tears. Nangis.
Tanya lah. Apa?
So when the baby is crying, ada tak saya nak tanya, when the baby is crying, is there any tears?
The mother did not mention anything about that.
One no.
I would like to know about the fluid intake of the patient.
The fluid intake was not mentioned, but the mother did say that Ryan lost some weight due to poor oral intake because of the fever.
Yeah, what he mean by poor oral intake? Tak tahu.
No appetite.
What mean poor intake? You see, people can take 4 to 5 times bottle per day. Probably taking 1 or 2 bottle per day. Or the kids breastfeeding, or makan dia tak kurang. You have to be specified lah what you mean by decrease oral intake. Suppose you get pampers, will you change 5 times a day, but now they change 3 times a day. Nurul, any question?
About the coughing just now. So I would like to know the nature of the cough. Is it whooping, or is there any presence of barking, or it's just like normal coughing?
I've mentioned just now, there's no whooping or barking cough, and the nature is chesty in nature.
What chesty mean?
Productive.
Huh?
Meaning there's productive cough, meaning there's
Wet
phlegm.
cough. Okay, anything else about the cough? Whooping and coughing. Whooping and ni only. No whooping, no barking. Anything else?
Exclude group maybe. Barking, no group.
Yeah, but I know. But what the other thing about the cough? You want to know? In infant, usually would you have the whooping?
They might have whooping in some condition.
Huh?
They might have whooping in some condition.
Yeah, but then in children, in infant, do they have whooping? Is a main thing.
I think it's not, because it's considered serious if baby under 6 months have whooping in the baby.
Okay, what are the if you want to look for whooping cough other than whooping, what are the things you want to look at? What are the symptoms that you want to look at when the child is coughing?
Vomiting.
What do you think? When the child coughing, the face will become
Red.
yes, red. Anything else?
Chest
What the
recession.
frequency of the cough? Afrina.
It was persistent.
Tak tahu.
Like I asked whether the cough is more prominent during cold
No,
weather,
any
such as early
question?
morning or at night.
Cough day or night?
It says cough was persistent throughout the day. Not mentioned that.
Nurul, any question?
Question about the cough or like
Question lah.
Okay. I think I would like to know, like it's already mentioned, does the patient has history of hospitalization before?
No, this was his first hospitalization, and he had no underlying disease or had undergone any surgical procedures before.
For the fevers, is there any recorded temperature?
Yes. For the fever mentioned just now, the previous fever, the 1 week duration punya fever, it was on and off and usually peaks at night at around 38 degrees Celsius. At the time of the clerk, it was 38.4 degrees Celsius.
Ain,
I just want to ask if there are any siblings or maybe any friends that have similar symptoms like the child.
The mother mentioned that Ryan had sick contact with his older brother who had cough. Other than that, there's no other contact history.
Ara,
I want to ask about birth history. Are there any events or abnormalities?
mendengar apa?
I want to ask about the birth history.
The
Birth history.
Are there any events or abnormalities from the patient's birth history? Was the patient born full term?
Okay, so for the birth history, for the antenatal history, it was uneventful, while for perinatal history, he was actually born preterm at 36 weeks via lower segment cesarean section, but there were no intra or post-operative complications. While for the postnatal history, he had neonatal jaundice for a month, but was not admitted, but he went to follow up at Klinik Kesihatan in Temerloh.
Anis,
I want to ask about his nutritional history. For how long was the patient breastfed the mother?
Okay.
how long patient?
Was breastfed by his mother.
Okay, so the patient was
yang main tu
Okay, the patient was exclusively breastfed only up to 40 days, since the mother claimed that he refused to have breastfeeding. So he was on.
Breastfeeding.
I don't know. It was mentioned. The mother claimed that.
Baby refused breastfeeding.
Since the mother claimed he refused to have it.
Mother refused baby refused breastfeeding.
Yes.
Wow. First time I dengar.
It was mentioned just like that. So he was on mixed feeding with formulated milk, Dumex Dupro, and then at the 3rd month, where the mother stopped breastfeeding.
Mother refused baby refused breastfeeding.
I don't think so, actually.
Did you believe that?
I think it's more of the difficulty to breastfeed rather than the baby himself is refusing.
Or mother's working or not?
Did not mention just.
Not mention mother's working.
No, did not mention that. Oh, yeah, right. Okay. Mention. The mother was. Both the mother and father is a tenaga mas worker, so working.
So perhaps different, is it?
Yeah.
Mother want to go to work. So they start the mixed feeding. But when you're guilty dengan depan doktor, apa you cakap? Whom do you blame? You blame the
baby.
Baby. Because first 40 days he can breastfeed normally. Atau the mother makan ubat herb jadikan susu jadi pahit. Tak tahu lah. Shamima, you think how bad is it the shortness of breath though? Before that, I ask you open. Anybody want to ask any questions? Open.
You would like to know about the growth and developmental history of the patient. Was it normal?
Yes, the patient's developmental milestone is normal and appropriate for his age, 11 months old.
Normal and appropriate to his age. Okay, lagi any questions?
Can I know about the immunization history of the child?
Okay, so his immunization is up to schedule according to the national immunization schedule by the Ministry of Health. There was no history of missed vaccination or any additional vaccination apart from the schedule. No allergic reaction to the vaccine. And the last vaccine he received was the first dose of MMR vaccine received at the age of 9 months old.
Any other questions?
I want to ask regarding the travel history. I don't know it is suitable or not according to the date of looking, but does they travels to red area or COVID-19 red area?
The date of clerking is actually into 2019, so it was not mentioned about that. But there's no kalau in terms of TB, there's no history of contact with TB patient. But for COVID-19, it was not mentioned because it's not yet pandemic at the time of clerking.
Any other questions? No more questions. And I quit. What you think? How severe is it? The shortness of breath.
Hmm, for the shortness of breath, I think it's severe enough because until the mother.
Severe enough. Dia mild, moderate or severe. Tiga je.
I think it's severe because.
Why you think it's severe?
Because firstly the mother can notice that the baby is breathing rapidly. Next is because it's also accompanied by wheezing sound and also the subcostal recession that shows
Why
that
it cannot become moderate?
Because the subcostal recession and also the subcostal recession and wheezing sound is one.
In moderate tak ada subcostal recession.
It can be, boleh juga ada. So it can be
Why can't we moderate?
Moderate or severe.
Either one lah. Oi, mana boleh ada tidur dua sekali. You have to decide lah. Nah, Sazwani?
I think it is moderate.
Why you think it's moderate?
Because first, for the accessory muscle usage.
Why can't be severe?
Because like if we refer to the severity of when the patient had the subcostal recession, it is usually moderate. When
severe tak ada subcostal recession.
There is. Maybe if we are referring to the pulse. Referring to the.
Is it cough is the one of the assessment for severity in shortness of breath?
I'm not sure.
Huh?
Maybe not.
Maybe not. Maybe mana dia? Maybe decide lah yes or no. Nurul Aiza, what you think?
I think it's moderate because first, there is signs of intercostal retraction, but with the just now doesn't mention about accessory muscle use, if I'm not mistaken.
Subcostal recession tu bukan sesuai masa use lah.
Yes, doctor.
Kalau subcostal recession tu bukan sesuai masa use.
If intercostal.
Subcostal recession dia which muscle? Afrina. Present lagi semula that part.
Okay. Okay. I will present that, and as well as I will include the vital signs to help. For the
I nak go to history saja.
The history je. Okay. Okay. So a few hours prior to admission, the mother noticed Ryan was breathing rapidly, and it was accompanied with wheezing sound and subcostal recession. It was sudden onset and it happened at rest.
Ara, what do you think?
I think it's severe.
Huh? Mild, moderate, or severe?
Severe.
Huh?
Severe.
Severe. Why you think severe?
The breathlessness occur at rest.
Huh?
Because the shortness of breath occur at rest.
Shortness of breath lagi?
Occur at rest.
At rest. Okay. Lagi?
Moderate, the shortness of breath will occur only during talking, when talking.
Huh?
Moderate.
Pardon?
If moderate, shortness of breath will occur when talking.
With talking.
Then there is no history of cyanosis.
If there is no cyanosis, it should be moderate or mild. Moderate or severe.
We must ask whether there is a history of cyanosis.
Afrina, ada isu cyanosis tak?
No. No cyanosis.
Huh?
No cyanosis.
Yang balik bagian tu semula.
The same sentence just now. A few hours prior admission, the mother noticed Ryan was breathing rapidly, was accompanied with wheezing and subcostal recession. Sudden onset, and it happened at rest. No facial congestion and no cyanosis on his lips were noticed.
You dengar bagian tu?
But the shortness of breath still okay at rest, so we can consider it as severe.
But I think it's a little bit different for infant, kan?
Siapa
I think it's moderate.
Siapa ada yang assessment also? Buka assessment tu.
It's protocol.
Protocol. Baca. Kalau mild apa? Baca. Mild.
Kalau mild, breathlessness when walking.
Lagi.
But in moderate, if infants, they will have feeding difficulty.
Daripada top sampai down. Mild tu apa?
Wait, it's not too. Wait.
Baca daripada top sampai ke bawah. Mild apa?
Kalau mild, breathless when walking, talks in sentences, alertness may be agitated, respiratory rate normal to mildly increased, accessory muscle usage absent, wheeze moderate, often only an expiratory. For SpO2 on air more than 95%, pulse per minute less than 100, PEFR more than 80%.
Moderate.
Moderate, breathless when walking for infant feeding difficulties. Talks in phrases, alertness usually agitated, respiratory rate increased, accessory muscle usage present but only moderate, wheeze loud, SpO2 92 to 95%, pulse per minute 100 to 120, PEFR 60 to 80%. For severe, breathless happens at rest. For infant, they stop feeding, talks in words, alertness usually agitated, respiratory rate markedly increased, accessory muscle usage present and severe, wheeze usually loud, SpO2 less than 92%, pulse per minute more than 160, and PEFR less than 60%.
So mild, moderate, or severe?
Severe?
Huh?
Severe.
Why severe?
Because the breathlessness happens at rest.
Lagi?
And the patient also have less oral intake. So um,
Wheezing dia macam mana?
so
Wheeze dia.
It just mention wheezing.
Huh?
There's presence of wheezing sound. It doesn't mention
Yeah.
whether it's sorry.
Ada mention wheezing tak?
Mention wheezing, but it doesn't mention whether it's loud or usually loud.
Accessory muscle?
Yes, subcostary recession. Oh, but it doesn't mention whether it's
Severe or
severe.
not?
Uh-uh.
Dia satu saja dia ada at rest. Shamima, what's the essence of the case?
An 11-month-old boy comes to the A&E department. He comes with rapid breathing.
Satu sentence je.
Okay, saya try semula. An 11-month-old boy comes with rapid breathing accompanied by chesty cough, and he has history of fever.
Nakwi, what you think about the case? Satu sentence.
It is a case of an 11 months old boy that was brought to the A&E department due to the rapid breathing accompanied with chesty cough and a recent history of fever and runny nose.
11 months old boy presented with rapid breathing.
And rapid breathing and
associated with cough.
And apa mak ada concern satu lagi?
Feeding difficulty.
11-month-old child who having rapid breathing and apa?
Fever.
Rapid breathing and fever. Tapi the focus will be on the rapid breathing. So what do you think come to your mind?
Bronchiolitis.
This 11-month-old child who having rapid breathing and fever.
Bronchiolitis.
Bronchiolitis. Itu jawapan dia. What the question come to your mind?
Oh, the question comes.
Infection, and it causes the airway obstruction.
What question come to your mind?
Why this patient is having rapid breathing and fever?
Why? What the answer?
could be due to several reasons. I believe our main concern right now is infection.
Si infection tu orang kampung boleh cakap infection. You nak doktor, you tak cakap infection apa? Otitis media. Cellulitis.
Bronchiolitis.
Lagi.
Pneumonia.
Lagi.
Asma.
Lagi.
Doctor, what about foreign body aspiration?
Lagi.
Less likely could be cystic fibrosis.
Cystic fibrosis 11 month old. Ayo, come on lah. You said the prior. This is the first time kan? Lagi apa lagi?
Meningitis.
Meningitis, shortness of breath, and coughing. Oi. Why meningitis cause shortness of breath? Faiz?
Pardon?
Why meningitis? How meningitis cause shortness of breath?
One of the complication can lead to sepsis.
Buka buku causes shortness of breath in children, infant. Buka betul internet. Buka Google. Shortness of breath, infant, cause. Apa? Apa jawapan dia pergi dalam Google?
Congenital heart disease. Congenital
Apa?
heart disease.
Apa?
Congenital heart disease.
Congenital heart disease. Apa benda congenital heart disease cause shortness of breath tu?
Oh, tak ni newborn.
Ada apa lagi? Causes tak ada dapat?
Inhaled foreign body. Inhaled foreign body.
Dah mention dah tadi. You baca satu persatu. From the start to down.
Allergies.
Boleh tak baca, you buka internet tu, you dah buka website tu, you baca A sampai habis. Causes of shortness of breath in infant. Apa Baca. Apa dia tulis? Tak ada? Aduh. Dapat tak dapat?
The differential diagnosis. Acidosis, metabolic acidosis.
Lagi baca.
Acute hypoglycemia.
Lagi. Itu je. Banyak kan?
Asthma, aseptic meningitis.
Lagi.
Bronchiectasis.
Lagi.
Bronchitis, chronic anemia.
Ini infant ke?
Yes.
You ambil yang mana satu? You tengok yang satu tengok.
In Medscape. Pediatric pneumonia differential diagnosis.
Dia orang akan cari pun pandai cari.
Transient early wheezing.
Ha?
Transient early wheezing. Viral induced wheezing. Heart failure.
Heart failure lagi.
Is it possible for croup and epiglottitis?
But they will, what the sign they will have?
Shortness of epiglottitis or croup? Which one?
Both.
Croups is will have a whooping cough.
Right?
No, barking cough.
Ah.
Whooping, barking cough, and also also inspiratory stridor, voice hoarseness, and respiratory distress in croup.
Do the child have that?
If the child have croup.
This child having the symptom tak?
Oh no, there is no barking cough.
Do the child have those symptom? No kan?
No.
Kalau epiglottitis, simptom apa dia ada?
High fever, ill toxic, looking child, intensely painful throat, saliva drooling, 4D, saliva drooling, dysphagia, and they will have mostly tripod position. But there's also no in this child.
Tak bagus lah. Banyak sangat sekarang dah banyak pergi kepada apa tu, hospital punya ni. keluar benda-benda macam ni sekarang.
Doctor, maybe COVID-19 can cause bronchiolitis.
Dia tak macam dulu dah. Dia banyak pergi ke apa tu, website hospital-hospital yang tak relevan. Dulu kalau put phonosograph, itu takibnya. Ya. Untuk infant dekat TTN juga, TTN. Ya, difficulty in breathing. Tengok apa yang dapat causes. Asthma, allergy. Balik from the summer. A cold, bronchiolitis, croups, asthma, choking hazard, that's all. Pneumonia. Banyak keluar Settle Children Hospital ni. Tengok. Doktor. Dia balik from the doktor. Satu ya heart failure. Dia terlambat dia.
Doctor, is it possible if the infants have botulism?
Adalah.
Ada. Okay.
Not good for you all. Tak macam dulu lah. Dia banyak saya pergi website sekarang. Website for university begini. Saya rasa dia orang pakai, ada satu teknik dia orang pakai. Tahu. Jadi Google ni is the more you website you pakai, betul akan naik dahulu. Tahu. Sometimes they use the ni. Last time if you put Google, this one. They give courses. They can give you all the list of courses. The causes of shortness of breath is from the respiratory, lagi apa? Cardiac, dan ada sistem kan. The causes from the respiratory, banyak kan respiratory, daripada pneumonia, bronchopneumonia, bronchiolitis, asthma, foreign body injection, emphysema, pneumothorax. And then from the cardiac, can be a heart failure. Then the other thing is from the other cause is from the severe anemia, acidosis. Dah tak ada dah dalam ni. Ada tapi kecil kat belakang. Dulu kalau you pin up, dulu kalau you pakai Google by right, dia just keluar apa you nak. Sekarang dia keluar apa tau, dia keluar Stanford University pada ni pada tu. Tak tahu kenapa dia jadi macam tu. Dia tak keluar apa yang kita nak. Kalau kita tanya kita dulu dia kan keluar apa kita minta tau. They say we want for us shortness of breath, children, causes, infant. Dia akan keluar ada list dia punya website where the list. Sekarang dia pergi mana? Dia pergi ke lain, dia pergi ke Stanford University, dia pergi pada tu yang bukannya ni. Even Mediline pun tak ada. Itu Mediline. Tak tahu kenapa. Ini kalau adult boleh keluar lah. Adult dia keluar anxiety, asthma, embolism, broken rib, excess fluid around your heart, choking. Ada keluar jugalah. Web medic. Dia pakai dyspnea, dia pakai dyspnea. Cuba pakai dyspnea children. Dia pakai dia pakai medical word. Kalau pakai medical word, dyspnea baru keluar. Foreign body aspiration, pulmonary atresia, tracheomalacia, cystic fibrosis, bronchiectasis, dysfunction vocal cord, vocal atresia, chest wall deformity, chest wall disease, respiratory muscle weakness. Itu bukan medical word ya. You kena pakai medical word sekarang kalau you nak cari, kata nak keluarkan daripada
Medical ward.
if you want to keluar daripada apa tu?
Dyspnea.
You kena pakai dyspnea, baru keluar causes dia. Kita boleh pakai shortness of breath. Kalau pakai shortness of breath, dia akan keluar. I want to teach you how to use your internet to find the knowledge. Faham tak? Very important because it will solve you a lot of times. Can we do our work now? We use the internet. Cardiac, this is one. Dia pakai deep snake. Dia tak pakai apa tu shortness of breath atau tachypneic. Masalah yang banyak kena launching. You dapat up to date kan? Itu up to date or not?
Yes.
Dapat.
Tapi rasa up to date kadang terlalu detail sangat for you all. Kan ditulis up to date. In terms of fibrillation dyspnea and pathology, cardiorespiratory and cardiovascular. Tapi this is for ni. I mean for adult. Untuk Harvard, apa punya Harvard punya ni, Harvard University. The reason I want you all to learn is that so that you all know how to use your panggil fingertip knowledge. Itu fingertip knowledge tak?
Sorry, Doctor, fingertip knowledge ke?
Fingertip knowledge.
Oh, fingertip.
Everything is at your fingertip. Skill to get the knowledge from the internet is another one thing. The internet, there's so many things inside. You have to have the skill. One is it whether you book, where you want to know the causes of to shortness of breath in children. One inside the book, second inside the internet. So you see, this is a child who come with shortness of breath and fever. The key is shortness of breath. So the next thing come to mind is that what causes shortness of breath in these children? What causes? You have to know the causes. The list of causes is from the book or from the internet. So in that case, you already have knowledge inside you. The problem with you all is that you are unable to combine the knowledge with the clinical. That's your problem. You're unable to how you are to combine knowledge and clinical is something witness about inside you all. So if you have these two combined, then you see before you know or before you clear already say this is the case of children with shortness of breath and fever. So you already have inside your brain the list of the causes. All the bronchopneumonia, bronchiolitis, apa lagi yang cause ni? And there's emphysema, pneumothorax ke, and then the lung abscess. And then there are all the causes. If you're talking about shortness of breath alone, you can think about is it the child is having about cardiac problem at the same time, or is it severe acidosis ke, or the child is having a pulmonary edema, inside your brain body aspiration, or inside your brain already. And then you clerk the case. When you clerk your case, you already know what to ask. You already know what to ask. The thing you can ask, you wait jackpot. You already ask, ada tak before dia makan tersedak-sedak ke ni semua, ada tak dia pernah dilahirkan dengan jantung, problem jantung ke, dia minum dia macam mana, tersedak-sedak, minum susah nak minum ke, termengah-mengah ke. So you ask the question, you already know what you want to get. So you see, when you present the case, we can know already your presentation is intelligent presentation, or you just present you just present you present because you hindsight in presentation or proactive presentation. Proactive presentation, you already know. You present the case, you already know what you want to ask. You already read, because you read around the patient. You read around the patient, so you read about the causes. When you have the case, you read the causes, then you go back and asking the case again, and then you write your clerking. Now we know this fellow did the homework. The second thing about this case, we come to acute, you have to know the severity. Why you have to know severity? Because it is mild, moderate, and severe will tell you your level of management. If the child is mild, probably just need some IV drip antibiotics. If child is moderate, probably need some oxygen, some nebulizer. If the child is severe, probably need a intubation. So your assessment very important. Mild, moderate, or severe. So the last acute case, you have to know the causes and severity. Chronic case is different. Usually you have asked present two cases chronic at the same time. Chronic cases, you have to look at story of the case. The case, so diagnosis in chronic cases is not a problem, usually because the diagnosis is already known. The child is asthmatic, but he's having an acute exacerbation of asthma. This is 4 years old, asthmatic child who having acute exacerbation of bronchial asthma. The next thing question to you is why the child is having acute exacerbation, and the answer for acute exacerbation inside the history, but you have to know the story of asthma first. Causes of acute exacerbation. Is it triggers? Is it non-compliance? poor compliance, medications inadequate, disease more severe. The history will answer that, but you have to know the story first. Very difficult for you all to understand because you not able to clerk the case. You're able to clerk the case when time come. But the thing is that you still have to combine your knowledge with a history. Key of the case is history, HOPI. Anything related to the story of chief complaint. When the patient come to see you, the first thing you must able to recognize is the chief complaint. If you're not able to recognize the chief complaint, you have to go back and sit down and ask again until you get the chief complaint. Something is not right if you're unable to get the chief complaint. Then for the chief complaint, you go to HOPI. The HOPI, then you go to the other history, then they present the other history. Afina, present the
Yes.
other history.
Okay. So we'll start. Should I go with systemic review first?
Go lah.
Okay. So for systemic review, general, the child was pink, alert and active, no pallor, jaundice or cyanosis. He is well hydrated
Why
despite
you want
having...
to talk about cyanosis? When cyanosis is HOPI.
Oh. All right, already mentioned just now.
No, not mentioned. You don't understand. Anything related to HOPI will be in HOPI, not in the systemic review.
I see. Okay. No rash, no decreased activity, loss of appetite. Yeah.
Lagi?
Head and neck, no dysmorphism, no neck stiffness, no ear discharge, ulcers or gum bleeding, no swelling around the face and neck.
Neck stiffness, you know from history ke? Lagi?
Cardiovascular, no orthopnea or paroxysmal nocturnal dyspnea, no chest pain.
Chest pain 11-month old. PND, you see, PND, proximal notional dyspnea is related to heart failure, related to the chief complaint. Why you want to put in the systemic review?
Oh, should be in HOPI. For respiratory system, no hemoptysis, chest cough dah cakap. GI system, no constipation, melena, bowel incontinence and frequent vomiting noted. No.
Bukan vomiting. Jadi vomiting dah dalam chief complaint.
Betul lah. Okay. Tak sure kenapa dia tulis sini. Hepatobiliary system.
You see, that's why key is penting, you know. Just key, yeah. Oh. You don't think at all. Skip that part.
Okay.
Like other history,
Let's go to past medical dah cakap tadi. Kena cakap past medical.
Ada past medical.
Tak ada any first hospitalization.
Okay.
Drug history pun tadi paracetamol je. No other drugs, no drug allergy. Birth history tadi dah cakap antenatal uneventful. Perinatal dia preterm at 36 weeks. Postnatal dia ada neonatal jaundice for a month tapi tak admitted. Growth and developmental history, developmental milestone normal corresponding to age. Nutritional history tadi exclusively breastfed up to 40 days. Lepas tu mixed feeding with formula milk, and then at 3rd month baru fully stop breastfeeding. And then currently he was given formulated milk and porridge with some proteins such as chicken and vegetables, as well as soft biscuit and bread. Immunization up to schedule, tak ada miss vaccination, tak ada added vaccination, and no allergic. And the last vaccine is MMR vaccine. Family history, parents, both parents are 38 years old, no known medical illness. Ryan is the last child. The other two older brothers, which are 4 and 9 years old respectively. No history of epilepsy, no congenital anomaly, no neurological disorder or autoimmune disease in the family, and no history of consanguineous marriage. Social history, he lives in Kampung Padang Tenggala with both of his parents and siblings. House has good water and electricity supply. Both his parents are tenaga mas workers. Father is a smoker. Otherwise, his parents are not alcohol drinkers or involve any high risk behavior. And there is nearest clinic kesihatan not far from his house. So that is for the history.
Okay. Any questions? You all? Any questions?
Doctor, so for systemic review, maksudnya HOPI, those yang memang related to shift
Review is
complaint.
not part of HOPI.
It's after HOPI. Okay.
You have the HOPI. Review is any system that you but not related to the HOPI, which you don't want to miss. That's all. Anything related to the shift complaint will be in the HOPI. Any other questions?
Doktor,
Okay.
maksudnya tadi kan doktor kata cyanosis we already mentioned in the HOPI kan? So macam systemic review bila general tu, sebab saya banyak baca case write up, diorang semua mention macam pallor jaundice cyanosis tu terus je dalam general appearance tu. So macam mana doktor? Kalau dia related terus letak? Maksudnya terus letak HOPI, kalau dia tak related baru mention.
Kalau dia HOPI macam lethargic and weak, is part of the HOPI. The systemic review is not there lah. It's there lah. Let's say patient will come with cellulitis. Then you can say lah systemic review active, no jaundice, no cyanosis. The patient can be shortness of breath. Patient is weak, lethargic, weak because no feeding. Why you want to put in systemic review? It's already mentioned inside the. It's there already inside the. Yeah.
Okay.
You know everything has to be. You have to think. Before you key inside. Bukan sesuka hati you letak je.
Okay, doktor.
Any other question? Okay, finish today. Okay. Ada teaching lagi you all? Tak ada kan?
Ada lagi session hari
Ada.
Selasa.
Ada.
With the same group.
Tak tahulah bila boleh balik you all. I tak tahu. I pun tak tahu you boleh balik. Sekarang ni 31 Mac disambung kan? Lepas tu 31 Mac, lepas tu sambung 31 Jun, lepas tu sampai next year balik.
Currently plan dia last Januari. Currently plan untuk kita orang mungkin balik macam akhir Januari.
Ya, tapi tahu kat February they expected 5,000 per day.
Oh.
I will first ni. Mungkin 3 minggu lagi. Tahu kita orang kita banyak spesialis yang pakai ni sekarang. Kita tahu. Kita orang semua high risk kan. Okay, any other question? By the time datang hospital, saya silap tak ada orang dalam hospital dah. Spesialis semua pakai tag kuning. Tag ni. Okay. Habis lah.
Okay, doktor.
Thank you, doktor.
Thank you, doktor.
Thank you, doktor.